Hi everybody, this is Dr. Lorn Allison with masterthebody.com, and today I wanted to do a short podcast on using frequency wavelengths to heal infections. Now, this could be somewhat controversial. Certainly, the idea of using frequencies for treating infection came as quite a surprise to me. I was working in a family practice office, and we had a patient come in that had been injured in a military exercise. Previous to visiting our office, that injury had been diagnosed infected with MRSA and treated with antibiotics. Now, the antibiotics did not really improve that infection, and then it was diagnosed as a pan-resistant or pan-drug-resistant PDR necrotizing fasciitis, flesh-eating bacteria. Now, this bacteria is defined as a non-susceptibility to all agents in all antimicrobial categories, and that is just a fancy way of saying antibiotics of any kind will likely not work. Now, additionally, he did not want to continue losing time treating with a drug that would likely not work any better than the antibiotic he had already used. And on top of that, the prognosis for the recommended surgery was not good. Now, unknown to me, and prior to my time working in that practice, there had been other patients who had visited this clinic with a similar infection, and the doctor that I was now working with in that practice had previously treated those successfully as well. Now, they had several devices in the office that were used to treat this type of infection with frequency wavelengths, and the patient hoped that within a day or two he might be able to make some progress and avoid surgery, but more importantly make the infection a thing of the past. Now, though I had been working in the office for a few years at that point, I had not seen a case like this come in, nor was I aware as to why this patient was coming to this practice instead of going to an infectious disease specialist for a third opinion, like you might think would be the wise choice. So to keep this story short, the patient was treated with different frequencies that were grouped together in a singular, quote, code, unquote. And that particular set of codes would be run 1.5 hours, approximately 2 times in the first week, again treated a third and fourth time in the second week. And after the first week, what I witnessed was the wound, which would not close previously, had closed. And after the second week of treatment, it was clearly healing. At that point, the patient left to go back to his home out of state. Now, post-treatment, it did heal completely with minimal scar tissue, and he did quite well. Now, I didn't post pictures with this podcast or the blog posts on masterthebody.com because a person in their position in the military needs to be kept confidential. But needless to say, I was thoroughly impressed, and then I went and bought the same technology pretty much within a month. And I initially, honestly, only planned on using it with my own family, and really just in case of emergency, considering what I know about the state of antibiotic use globally and the efficacy of the antibiotics and the trajectory of the inefficacy of what's going on in the antibiotic world. I thought this would be an excellent way to try to help protect my family in the future from potential pan-resistant infections. Now, my isolationist attitude in terms of using the equipment didn't last long because I had a lot of patients coming in that seemed as though this might be an opportunity to use the technology beneficially and help where standard treatments were not working. So, as a practitioner, if someone comes in with a problem and they've run the standard of care for that problem and they are not getting better, if you have seen something that is maybe off the books and is not harmful that potentially can help, of course, it is your duty to at least provide the information to the patient and allow them to make their own decision. Now, after I had started to use it regularly, the results have been and still are hard to believe for me. I've treated bone spurs, plantar fasciitis, H. pylori infections, blastocystis infections, respiratory problems, cysts, a variety of other issues. But probably because of the level of the problem that the infectious agents can be when not treated effectively, I have been most impressed by using frequencies on infections. Now, I also do a short podcast on a case study using it for H. pylori infection. And I want to say as well that when I saw the equipment for the first time, I thought that it was primarily used for musculoskeletal problems, which it historically is, though I soon learned it can be used for much more. Later, I learned many practitioners were using these devices to heal infections, bone problems, speed up healing processes, and considerably more, to which the efficacy was striking. It was almost like a hidden therapy that people didn't like to talk about it because it wasn't necessarily a standard of care. So you would say, well, if it really works so well, then why wouldn't the general public know about it? Well, there has been some media information put out about frequency and electromagnetic treatments, maybe not quite as prolific as they are actually being used. For instance, I give a couple of links on the website at masterofthebody.com in the blog. They were using frequencies to treat glioblastomas in the brain. There's certain technology that has been created for that, and there is research on it as well. You can see the references on a blog page about this particular podcast. But aside from the occasional story, you won't hear much about it unless you know how to search specifically online. And the problem in proving the effectiveness of this type of technology by stacking up case studies is that many practitioners will not openly talk about the use of frequencies as a treatment modality for anything other than muscle stimulation. Speaking publicly about these things is risky because it is not an accepted standard for dealing with any physical problems except for muscle stimulation or electric stim, e-stim for short, and relaxation in terms of relaxing, musculoskeletal issues. Treating serious physical problems outside of the accepted use of these devices could get you ostracized or worse, draw the ire of a professional regulatory board. So doctors basically bypass this by not using frequency therapy unless there seemingly aren't any other treatment options available to deal with the problem, or other standards of treatment have failed. Now, my goal in passing on the information is to provide people with the knowledge that this type of treatment is coming of age, and the more people that know about it, the better, as they can start asking their doctors about it and open up the conversation when other standard options have run out. And of course, I have to put the disclaimer in that obviously if you are faced with a potentially serious infection, or which you may or may not know about, the answer should always be first conventional treatment with the appropriate provider or practitioner. I hope this at least piques your interest about these possibilities. You can pull up the blog post with a couple of links there which have some interesting information that you can go down the pathway and start digging and looking for more information on this type of thing for yourself. This is Dr. Lorn Allison with masterofthebody.com, wishing you the best in health.